Hello and welcome everyone. We would like to give you a warm welcome. Very glad that you're here joining us today for the webinar on high impact common services on UN Common Medical and Clinical Booking by WFP. My name is Luis Diego Cov, and on behalf of the Development Coordination Office and the Country Business Strategy team, I would like to thank you for being here. I will be your moderator for today's webinar. In a moment, I will introduce the distinguished panelists and speakers. Before we get started, I'll go over some very quick housekeeping notes. The webinar is being recorded, and we will send you the link to the Business Operations UNSDG's YouTube channel, where you can find also previous channels and where we'll be posting future recordings, so feel free to subscribe there. You may also refer to the practice notes on the handout section in this webinar, and we will also post the link on the chat box and on the follow-up email so that you could use this as a guidance for implementation. Don't feel shy to ask questions in the question box throughout the webinar, and you will also hopefully get a chance to raise your hand at the end in the Q&A section. These webinars are for you, so please take every opportunity to ask any question. We will also be available and the WFP colleagues for future follow-up. Near the end of the webinar, we will also share a short feedback link where you can fill out a form. It takes about 1 minute, and it helps us see your feedback about the webinar, help us improve them for the future. With that, I will introduce our esteemed speakers and panelists in order, speaking order. First, we'll hear from Dr. Sergio Arena. He's the chair of UNMD and WFP Wellness Director. We'll then hear from Clementina Dalcin, Common Service Manager of the Humanitarian Booking Hub, followed by Flavia Cruciani, Accommodation and Clinic Customer Support Manager. Then we'll hear from Dr. Filmon Beraki, Health Manager in Monrovia Clinic in Liberia, and Dr. Saeed Mohammed, Health Manager in Addis Ababa. Samir Frotan will also be joining us. He's the Global Lead for the Business Operations Strategy, and hopefully we'll hear and we're joined by Alessandra Bianchini, the Global Mobility Manager for the Humanitarian Booking Hub. We're also joined by other regional BOSS coordinators and WFP colleagues that have been assisting, will be assisting in the chat and have been assisting in the creation of both the practice note and this webinar. We will not go over the high impact common services and what they are. Briefly, as you know, they're common services that have been identified for having high efficiencies, either in cost avoidance, quality improvement, or good practices from other agencies. So with that, I would like to hand it over to Dr. Sergio Arena so he can share with us about this common service. Dr. Sergio, over to you.
Thank you, colleagues, and thank you, DCO, for hosting us today. It's a great opportunity for WFP to share with you the solution that we have adopted for our staff to allow them to more easily access field medical services when they are deployed to deep field duty station. Since I joined UN, I've always been faced with the same problem. Sometimes we have the services available, but colleagues who are highly mobile and always traveling, they don't know how to access them. Now, today, technology allows us an easier access to these services, and the solution that Humanitarian Booking Hub today will show you is certainly the tool that would probably solve this problem. So I really ask you to enjoy and to follow with attention this presentation today, because we believe this is a solution that certainly meets all the criteria of the high impact common services for the UN. And we at WFP are keen to share the solutions that we have produced for us that can meet the needs of also other agencies. So thanks again for the opportunity and for your attention in advance of what you will be seeing. Now, in a nutshell, I want to clear from the outset what this solution does and what does not, okay? So that we can clear our way from any potential misunderstanding. This solution is the digital solution, portable on all mobiles, all smartphones, that allows us, wherever we are in the field, to have immediate access at the distance of a couple of clicks or touches on a smartphone screen to UN clinic service, which is primary care, and the counseling service. And this without the need to ask, well, today I'm in Liberia, what's the number of the UN clinic to book a consultation? Or I want to talk to a counselor because I have an issue, but who shall I call? Okay. The solution allows booking, scheduling, and for the interested facilities, also the management of the consultation in terms of stats, reporting, and eventually invoicing. The tool does not address clinical notes taking and clinical notes reporting. Why? Because these are highly confidential data that remain between the patient and the doctor or the healthcare provider that provides the services. So, and I'll close, the Humanitarian Booking Hub really optimizes the capacity to make appointment and to manage consultation appointments and also invoices creation for everyone in the UN, provided that its email domain has access to the Humanitarian Booking App services, which are many more than only the one that we are talking about today. At the distance of a single sign-on, we have a unique UN platform where many services are available, and in particular, easy access to medical consultation and to counseling support. So enjoy the presentation, and I'll be ready to take questions at the end of the process. Over to you.
So Sergio, thank you very much for your great introduction and for sharing the key benefits of using the platform for the field medical services. So let's start. I want to start with the introduction of the Humanitarian Booking Hub, which today is the largest UN marketplace to book UN field services. WFP have developed the platform 6 years ago, firstly to manage WFP provided guest houses, and since then other services were added like field medical ones, and other UN agencies have joined the platform. So as you can see here, there are the listed all the UN agencies that are providing field services through the platform. Today are 10. And through the platform, staff can access to 1,354 UN field service points in about 98 countries. As you can see here, there is a list of all the services available, UN vehicles, flights, UNAS, and also COVID support flights that we developed last year, UN guest houses, UN DSS hotel, and of course UN clinics and UN counselor. So to introduce you better the hub and all the services available, I would like to share with you a quick video. Here we are.
Welcome to the Humanitarian Booking Hub, the innovative 24/7 field services platform, featuring guest houses, hotels, flights, drivers, and wellness services for aid workers in remote locations to deliver last-mile aid in over 90 countries. You can find information, pictures, and prices for over 260 UN guest houses offering accommodation around the globe. More than 2,800 UN vehicles are also available to book in just one click for airport pickups, in-city travel, and out-of-town missions. You can also book UNHAS flights and emergency aviation services, reviewing schedules and prices, or available medical services in more than 70 UN clinics. The website also provides you with information on UNDSS listed hotels in selected cities and useful tips for a safe trip. Bookings are confirmed by email with useful details. To make your use as easy as possible, the Hub is available also in French and even as a mobile app to make bookings on the go. You can review the status of your bookings, add your favorite services for booking in a click, and review your personal profile. Help us improve our services by letting us know how your travel experience was. Download the Humanitarian Booking App or visit humanitarianbooking.org now to begin an easier journey out into the world.
So let me go back to the presentation. Today we focus on the UN medical services available through the Humanitarian Booking Hub. We have today 3 UN agencies that are managing their medical services through the same platform. And we have onboarded since now 73 UN clinics in 67 locations in around 48 countries. And we also offer through the platform the possibility to book a consultation with 35 UN counselors. And as of today, we have connected to the digital solution to manage their medical services 291 medical staff. Some of the benefits on the adoption of the digital solution is, first of all, the Humanitarian Booking Hub is a custom-made UN property solution developed for UN agencies and developed 100% by WFP. As I said before, is used today by 3 UN agencies for their medical services, offering to their staff. And we don't have a royalty to pay, and there's no external outsources. Mutual recognition can help you to onboard the platform very quickly, as we have a standard service agreement, which is the same for everyone. Another important benefit is that the platform allows staff to book different field services available in a given country or location, with also the opportunity of cross-services booking, with no need of any registration to access the platform. Then the front end for staff self-service booking, and of course the digital back office, can be standardized according to the UN agency needs, and the platform is also available through the app, and all UN staff can download the app. Thanks to the common back office, we can also compare service KPIs to boost efficiency, and the platform, in the case of the medical services, can streamline the appointment management to help increasing the utilization rate of the medical service and also help the adoption of common services. The platform also can help provide comparable efficiency gains, which are obtained using the digital automation, and also can help achieve quality improvements. And in general, we provide continuous service improvements, sharing the best practices across the UN, as we developed the hub in 2015, and since now, so many improvements and new features have been added. Thanks also to the feedback that we receive from colleagues who use it every day to manage their services. And the aim is to continue improving the digital platform to support more and more colleagues who work in the field. So thank you. I want to leave now the floor to Flavia for a live demo to show you the both sides of the platform, and see you after the demo. So over to you, Flavia.
Thank you, Clementina, and thank you, Luis Diego. So it's a pleasure today to guide you through our journey on the Humanitarian Booking Hub. The demo will be divided into 2 parts. We're going to see first the benefits for users, and then the benefits for service managers through the back end of the platform. But let's start from the beginning. The one that you see now on the screen is the Humanitarian Booking Hub, which is a booking service available for all humanitarian staff. This includes, of course, all UN agencies who can directly log in using their corporate credential on the hub, so no registration is needed. but this also includes NGOs and other organizations which are partners and which to access the hub are required to quickly create an account. Given the wide audience of the platform, each service, specific service provided through the hub can be customized in terms of visibility, meaning that if I click on Explore, I'm prompted to see the map of the world with all countries where at least one service is available are highlighted. And in this case, I see all services available for WFP because I logged in with a WFP account. If I click on one of the countries, I'm prompted to see the comprehensive footprint of services in the given country that I'm selecting. So these cross-booking features has a proven effect of increasing the number of customers for your specific service. Because, for example, if I'm a staff traveling to Sudan and I access the hub to book a driver or to book a guest house, I can already see that there are a number of other services available, including one UN clinic and one staff counselor, so that I'm prompted to book all services on the same platform as a unique entry point. I can do this, of course, for all countries available, but let's go to Nigeria. And when I click on Enter, I can see a map of the country with all locations where at least one service is available are highlighted and clickable. If I click on Lagos, we can see here that there are a number of services available, and let's start in practice our journey on medical services. So first of all, we have two different kinds of booking available for medical services, which can be, of course, chosen by the service manager. The first one is a standard booking clinic. So when I open the page of this clinic, I can see the service point page with some information, including pictures, but also a comprehensive description of the available services of the clinic. Of course, I can add the physical address, their operating hours, and the emergency contact numbers. If I wish to submit a booking request for this clinic, I click on Request Your Booking. And as you can see, I'm prompted to the booking form, which is already pre-filled with all my basic information. These information are stored by the platform and automatically retrieved based on my last submitted booking. So from the first time I submit a booking, I won't have to add this information again. Everything will be automatically retrieved, and I can, of course, change the information if any of them has changed in the meantime. We are going to see now the first available optional feature for the clinics, which is the appointment modality. If a clinic offers both face-to-face and online consultation, we can activate this modality on the booking form for each specific service, and the patient, while booking, they can automatically request, for example, an online consultation or an in-person consultation. If I request an online consultation, once my appointment is confirmed by the clinic staff, I will receive an automatic Teams link to access my online consultation, which is going to be, of course, also accessible by the doctor himself. On the first part of the booking form, there are all the details of the requester of the appointment. On the second part, this refers to the patient. So, of course, if I'm requesting an appointment for myself, I will insert the patient information as to be the one from myself. But I can also book for a dependent. So if in this case, for example, I'm booking for my son, I will insert the name of my son, the patient date of birth and gender, and then I can select the reason for consultation. The drop-down list that you see here as a reason for consultation is fully customizable based on the service provided by the clinic. So when we set up the booking form for a specific service, you can provide us with the list of services available, and we can make this list exactly according to your available services. Since I am now booking a standard booking clinic, this means that I'm only suggested to select a preferred visit date for my appointment. So I can choose any of them. I can then add any remarks if needed, and I can also add an attachment directly to my booking request. When I request my booking, I can see this screen and I will receive an automatic email confirming that I've submitted the booking request. In this case, I will receive a copy of all the details that I've inserted on the booking form on my mailbox, and I will receive an email saying that the clinic staff will process my booking and let me know whether it is confirmed or not. As you can see, the cross booking is also available after you have submitted the booking. So once you select one services in a given location, you are prompted to see all the available services, the other available services in the same location. In this case, we see that in Lagos, there is a UN driver available to book. Of course, this is the same. If I'm booking a UN driver, I will see that there is also a UN clinic available in the same location. And this can, of course, increase the number of customers for your service. Let's go back now to the map and select the second type of booking available for medical services. This is an instant booking service. As you can see, this is the page is exactly as the one before. It has a customizable button here, which we can add to add any information downloadable by patients before requesting the booking. But when I go to request your booking, the form is similar to the one we have just seen, but I can see that, for example, there is no appointment modality here. This means that this clinic does not offer online consultation, and we didn't activate the possibility of booking an online consultation through the booking form. I can insert as well the information. The different thing for instant booking is that when I click on preferred visit date, on the calendar, I can already see only the available dates as set up by the clinic staff. We are going to see in the second part of the demo how the clinic can set up this availability. But let's say from the perspective of the patient, I can only select available dates for my appointment. So if I select an available date, for example, the 31st, and then I click on time of visit, the time of visit shown is the only available time slot for my appointment as set up by the clinic, and which has not been booked by someone else, of course. So I can already see which time I would like to have the appointment, as you can see in this case, the duration of one appointment is set to be 15 minutes. However, this duration can be customized as well based on your needs. So if you wish to have a standard appointment to be 20 minutes or 30 minutes long, we can, of course, set this up for you. The second important thing is that the time of visit drop-down also shows me the automatic converter of time zone. So since I'm currently in Italy, giving this demo, but I'm booking a service in Nigeria, the time slot show me the Nigeria time, but also the time automatically converted on Italy time, which in this case, for example, is this. If I select the time of visit, and then I can select the reason for consultation, which is, of course, customizable exactly as before. I can then request my booking and submit the booking, which in this case will be automatically confirmed by the system because I'm already selecting an available time slot. Before submitting the booking, I would like to show you that there are also other options. So if a day for appointments is fully booked already, the day will turn to orange, meaning that I can still request a booking for the 28th in this case, but I can only request a booking as a waiting list. So my appointment in this case will not be automatically confirmed because I'm booking just a waiting list. If the clinic staff then confirms my booking, I will receive a confirmation email informing me that the booking has been accepted. Exactly as before, I can see the other services available in the location. Finally, another medical services we have available on Hub are staff counselors. So this is the page of a staff counselor service. We can add, of course, pictures here, but you can also customize this description of the service. This is, of course, a test location. I'm not a real staff counselor, but this was just to show you how you can prepare the page exactly as you want and make your counseling services available too. From the Humanitarian Booking Hub, I can also leave a feedback for each service booked. So if I click on feedback on the top of the page, and I can access the instant survey showing me all bookings which have been confirmed for my account, and then I can leave a feedback for each one of them. So today we see the clinic one. Let's select. From here, I can leave a comment which will be automatically received by the clinic staff from the back end of the platform. So, and I can add here, for example, great service. Thank you. And then send the feedback, which will be received by the clinic staff. It's important to note that there is no rating for this kind of feedback, because for medical services, the only purpose of having this is to for service improvement. Is not for rating the clinic per se. So I can send my feedback and then go back to booking services. Everything that I just show you now on the website is also available as a mobile app. So I would like to take a few minutes just to go through the mobile app. If Luis Diego helps me in sharing the screen of my phone, thank you. So this is the Humanitarian Booking Hub mobile app. The app is downloadable from the digital stores for both Android and iOS phone, and is of course free of charge. From the mobile app, you can access services exactly as we have seen now. So I can click on UN Clinic and see the available services, the available medical services in all countries shown here. The important additional feature through the mobile app is the possibility of booking offline. So if you have if a patient is traveling through a deep field location where perhaps the connection is erratic, he can still check the clinic's information, check all the information here, request the booking, and all the steps will be saved offline and then will be submitted as soon as he gets the connection back. From the service page, I can also mark the location as favorites, as I just did now. And when we go back to the home page of the app, I can show you also the dedicated section here. If I click on the three lines on the top left side of the page, I can access these specific sections. If I click on my bookings, I can see all the bookings that I have requested on the website and on the mobile app both. On the top of the page, I will see the bookings which are still pending. So the requests that I have sent, but which are not been processed by the service manager yet. I can, of course, scroll down and see also my accepted bookings. And for each one of them, I can click on the booking and visualize all the details exactly as I received in my email. So I have 2 entry points for this information. I can check it, and I can also cancel the booking autonomously from the mobile app. Going back to the sections, you also have the favorites section here. So from here, you can access all locations and services that you have marked as favorites, so that you can book them even more quickly than before. If we scroll down, we see the clinic in Bangladesh, which I've just marked as favorite. Finally, I have the profile section from where I can visualize all the details about my account, which are automatically retrieved when submitted the booking. So you can always go back here and update this information for an even faster booking experience. The mobile app is also available in French by clicking on the language here. And this, of course, is true also for the website. This is, of course, to increase the accessibility for patients in each country in the world. But let me go back now to the website. Thank you, Luis Thiago. So we finished now the first part of the demo dedicated to benefits for users, but we're going to see now the benefits for service managers. Each time someone requests a booking for your service, you will receive an automatic email informing you about it, and you need to access the backend of the platform to visualize and act on that request. To do it, you must click on Digital Office, and by clicking on this button on top of the page, I'm prompted to see the Global Service Center for the different line of services. You will select the location of interest, and then when clicking on Go, I can see the home page of the backend of the platform. This section is only available for Service Manager, as they have been communicated to us, so that you need to have granted access to see the digital office of the clinic. First of all, since this is an instant booking service, which is optional, I want to highlight that you can choose whether you have an instant booking or a standard booking service. This is an instant booking, so I have this section called operating hours, from where I can set up the availability of my clinic, exactly as it will be shown on the booking form that we have seen before. So I can set up the standard slot showing the normal operating hours of the clinic. So I must do it just once. And then I can create another special slot, which is gonna be for special days, which could be, for example, national holidays in which the clinic is closed. You can easily customize that as a self-service directly from the digital office. So you will be able to do it quickly and autonomously. But let's go back to the digital office and show you the booking section. From the booking section, I can directly see the day. So today is the 26th of May. I can see that I have 4 appointments here. Since this is an instant booking service, these appointments were automatically accepted by the platform based on the operating hours that I have set up for my clinic. Of course, when I have an appointment here, I can always modify it. So I can cancel the booking if I receive notification from the patient say that he will not be able to make it for the appointment. I can cancel the booking, or I can also edit it. So I'm always in charge, of course, and I'm always able to modify the appointments which have been confirmed automatically by the platform. Going back to the booking list, I want to show you on the 28th, this is the date in which we have booked the waiting list. So as you can see, the accepted bookings are shown below, and these are already confirmed, and the patient has been automatically informed about the time and date of the visit. However, for this same date, I have also a waiting list. If you have a standard booking service, all appointment requests for your clinic will be visualized exactly as these ones. So you will have a booking request which is not confirmed, but you can process quickly by clicking on Not Processed, and then you can decide whether you want to accept the booking request, and you can assign a consultation time. You can edit the booking request and change the consultation date and assign a consultation time, or you can also reject the booking request, also adding the reason for rejection, which will be automatically communicated to the patient. Indeed, each time you perform one of these actions on a booking request, the system will send automatic email confirmation notifying the patient about the action that you have performed. So as a service manager, you will only need to process booking requests through the digital office, and all the basic communication with patients will be done for you by the platform. So this is an instant booking. All my bookings are already accepted here. But if I delete one of these appointments, so if I click on the button and I click on cancel, as you can see, the system has an automated waiting list replacement feature. So I can decide whether I want to cancel this booking and just leave the time slot empty for someone else to book, or I can just select one of the bookings that I have in the waiting list and automatically replace it in here. So when I click on replace and then I confirm, in just 2 clicks, I'm at the same time canceling the booking request, the appointment confirmed to the patient who will receive a confirmation of the cancellation, and at the same time, I'm confirming another appointment which was in waiting list, and the patient will be automatically informed. So this is an important feature for time saving in managing your medical services. From the home page of the digital office, I can also visualize all bookings from a calendar view. So when I click on doctor's calendar, I can see all the appointments that I have, this, for example, for today or for Friday. And I can click on any of those and visualize the details of the booking inside. So I can visualize them. I can also change the preferred visit date or the consultation time. So I have the possibility of editing appointments also from the calendar. I can also delete a booking request, and I can add a new appointment manually if needed from the calendar itself. From the digital office, I can also create invoices for my appointments. So if I click on invoicing, and then I'm prompted to create an invoice for an appointment, the list of accepted appointments is automatically shown inside this list. So I can either select one of the appointments from this list, scrolling the pages for May, or I can select another month, or I can just type the name of the patient in the search box. And then when I select the booking, you see that the booking form is automatically pre-filled with all the information retrieved by the booking, by the appointment registration. So I don't need to insert the information again. Everything is already retrieved here. As a doctor, I can only add the description, the diagnosis description, which could be, for example, pneumonia. And then I can add the ICD classification for this disease, for example, CA40. I can then look at the charges section, select the currency of my invoice, add the service which has been used, the price for one consultation, and the quantity. I can also add additional services, for example, medication. I can add the prices here, and let's say 3 boxes. Everything is calculated by the platform, and I can create one unique invoice for all services used by the patient. I can then select the payment method. I can add any comment if needed, which will be, of course, saved inside the invoice. And then before creating the invoice, I can also decide whether I want to send a copy of this invoice directly to the patient, and if I want to send a copy of this invoice directly to a third party too. When I click on create invoice and I check the total amount and then click on confirm, the system indeed creates 2 different versions of the same invoice. It creates one invoice, which is the one for the patient, and the invoice contains the diagnosis description. So this is the one going to the patient, and also, of course, all the other details about the invoice. But the system also creates an invoice for third parties where the diagnosis description is not available, but it only contains the ICD classification for the diagnosis. This, of course, is to preserve patient's privacy. Let's go back here, and from the digital office, I can also see the customer satisfaction section. So click in here, I can see all feedback that was left for my clinic through the feature that I show you on the booking website. If I click on see remark, I can see the remark for each booking, and then I can take note of them. I can also assign a status if I want to automatically send these feedback. This, for example, it suggests to make the ultrasound available at the clinic. So if I receive this request quite often, I might decide to forward them to the forward them for action to someone, or I can just export all feedbacks received and then share it with whoever might be interested in this information to make, of course, to evaluate whether it would be okay to make this service available as well. From the digital office too, I have some supporting sections here, which are always available for service managers. We have some booking manuals dedicated to patients, so this can be shared with patients if they have any difficulty in booking the clinic. You can share the 3 steps booking manual. You also have a digital office manual, which is a comprehensive explanation of all the sections for the digital office, but you also have access to some recorded video trainings as well. Of course, if you decide to make your service available on the Humanitarian Booking Hub, we will be providing a dedicated training to all service managers, and of course also according to the type of booking that you will choose, and we will follow up on the implementation phase and for as much time as you will make the service available. Thank you, and I will leave the floor back to Clementina.
Thank you, Flavia, for the demo. So as we are running out the time, I don't list you again all the benefits for you and personnel that you can see here, but also you will receive the presentation, and also for service administrations, but Flavia covered very well all the benefits. I want just to stress out on some of the most relevant one. For example, for the UN personnel, to highlight again that the Humanitarian Booking Hub is a unique entry point for different field services, as you have seen during the demo. Staff can access in one click all the available services in a given location without any registration, and after have submitted a booking, can access automatically to other additional services available in that location. On the other hand, for the benefits of the administrations, Flavia explained to you very well all the benefits, showing you the real demo. And just want to remind you again the benefits on the self-service to manage your daily activities, such as the setting of the operating hours of each clinic that can be set up and updated anytime if needed. And the another crucial tool is the automated patients waiting list to replace with a new patient automatically when an appointment is cancelled. We also want to highlight that we are streamlining big principles such as the focus on the customer satisfaction, both for users and administrators, so users can leave their instant quality feedback from the website and the mobile app, and medical staff can track the customer satisfaction directly from the digital office, checking the comments left by the patients and act if necessary. Thanks to the use of the platform, there is also great potential for efficiency gains. If you use the platform, all the tools available through the platform, we have calculated 3 different efficiency gains. So first, you can save working time thanks to the automation. Some examples are the online booking management with the automatic data retrieval for clients, the automatic confirmation of each appointment, the digital appointment planner for the doctors, the automated monthly reporting, and also the creation of invoices with the automated data retrieval of the patients. The platform can also enhance the optimization of costs. Efficiencies obtained through the digitalization of the service can optimize the overhead costs by increasing the utilization rate and also improve the visibility of the service and therefore the access for staff through the global platform. So in general, this global solution, digital solution, provides great opportunity to support the accessibility of common services with consequent optimization of the asset. Then quality improvements are also crucial in improving the customer experience, in streamline the service management across locations, countries, and UN agencies, and also increasing of transparency of service accountability. So now I'm glad to leave the floor for a few minutes to some of our colleagues in the field that we are here today to share their experience on using the platform. I welcome Dr. Philmon Beraki, Health Manager of Monrovia UN Clinic in Liberia. So thank you very much to be here, and over to you. Dr. Philmon?
Good morning, colleagues. Can you hear me?
Yes, we can hear you.
Thanks, Clementina. Thank you, the Humanitarian Booking Hub, for giving the opportunity to give a few words of feedback on our experience of the utilization of the system. The UN Clinic in Monrovia has been one of the beneficiaries of the Booking App since the inception of the system. We introduced the system to our staff by repeated broadcast message awareness sessions, including one-to-one guidance. At the moment, it is part of our routine booking method for the clinic visits. The updates and the improvements are so amazing so far. It has been beneficial in many ways. To mention some of them, increasing access to services due to the visibility in the UN Common Platform. Prior to the introduction of the system, patients had to call, send an email, or come in person. We had no standardized system of booking. So some requests has been missed, some of them unnecessarily repeated, and so on. By using the system, it's easy for patients to send specific requests with the time of visit. It's easy for us either to accept or amend the system, the time, or reject it for any reason. Waiting time at the clinic has been reduced. The second benefit became the digital entry point for the clinic service. During the COVID-19 pandemic, walk-in was discouraged, and we relied on the system by giving instructions to staff requesting booking. Therefore, the system became the entry point for seeking information and also medical advice. The other benefit is the easy access for UN staff and dependents. Staff members download the app and send booking requests easily. Clinic beneficiaries having non-UN email address are also able to access the system by easily creating an account. The other benefit, the improvement of the management of appointments. Once a staff member creates a consultation request or visit request, the clinic staff will have access to the generic clinic email address, can see the request. Immediate action can be taken, whether to accept a request, amend the time of the visit, and accept or reject the appointment, and give appropriate reason for the action. Staff members receive the information on acceptance or rejection of the request immediately. There is no need to come to the clinic for asking for information or requesting for visit or lab test. It is so vital to our day-to-day patient visit, consultation, booking for example, for COVID-19 testing, COVID-19 vaccinations, which are being run at the clinic at the moment. In conclusion, I can say I testify that the system is vital for the clinic's organized booking system, collecting statistical data when fully utilized also for invoicing and cost recovery activities. It is a vital resource for upgrading the clinic's booking and data management invoicing. Thank you very much. Over to you.
Thank you very much, Dr. Filmon. And let me welcome Dr. Saeed Mohamed from WFP Clinic in Addis Ababa. So over to you, Dr. Saeed, for your contribution. Dr. Saeed, can you hear me? Can you please unmute you? Okay, it seems there's some issues with Dr. Saeed. So I continue, maybe he will join us later. So I'm about to conclude the presentation saying that the hub is a natural enabler of BOSS and CBO across OMTs and UNCTs. The journey on the use of the platform can be summarized into 3 main steps. So the digital transformation of the service delivered, the gathering of seamless data, and the opportunity to explore collaboration among UN agencies. There are also, these points are also in line with the BOSS framework to identify opportunities on common collaboration and achieve efficiency. So I conclude inviting you to visit the website humanitarianbooking.org, download the mobile app right now to start explore the platform services, and all the information about the benefits, the description of the service, and also the efficiency gains. You can find them in the medical services practice note, which is available also in French, or you can just ask and talk to colleagues that are already using the service to have a real feedback from them. You can contact us at any time at the email global.humanitarianbooking@wfp.org. We will be more than happy to offer you free demo to show you all the potential of the global digital platform. So thank you very much for your attention, and over to you, Luis Diego.
Thank you very much, Clementina and Flavia. Before we open up the floor for questions, feel free to raise your hand if you do have any question. I'd like to hand over to Zamir Frotan in case he wants to comment how to implement these services with the business operation strategy. Zamir?
Yes, thank you. Thank you, Diego, and thank you, Clementina, Flavia, and the team from WFP for organizing this webinar for our operations management teams globally. Colleagues, Clementina already indicated how you can incorporate this common service in your BOSS, but since some of the countries have already developed their business operations strategy, I think today we have 124 out of 131 countries that have already completed the first BOSS 2.0. You don't have to wait for a year until your BOSS review starts in order to jump on and collaborate on any of the common services under the Humanitarian Booking Hub, or in particular on UN Common Medical Services, in case if you have medical services available in your country. So you can already bring up this conversation in your UNCTs and OMTs and start preparing in terms of your collaboration Alessandra, Clementina, Flavia, and the team is out there to support you, probably to give a dedicated session in your OMT if necessary on the benefits of the hub, or on the specific questions that you may have on the UN clinic or other services that they offer, so that you can start collaboration. Even if you can start a small collaboration here with any agency that is leading the medical hub and medical services in your country office or in your location, they can initiate this platform as an efficient way of service provision and interface to the users, and then gradually the other agencies could join it. But our recommendation is to incorporate this and tackle this through your business operations strategy. Start your collaboration, and as soon as you have an opportunity to reopen your BOSS and include new common services, incorporate this common service in your BOSS so that you can report on its benefits and efficiencies gained via this. With that, I'm going to hand over the floor back to Diego to see if we have any questions from the colleagues. Diego, over to you.
Thank you, Zamir. We did have a hand raised by Almaz Zerai. Almaz, if you would like to unmute yourself and ask the question, feel free to do so. And anybody else also that would like to do that. Over to you, Almaz.
Okay, thank you. Thank you, colleagues. Thank you, Clementina. Thank you, Flavia, and the WFP colleagues for the humanitarian booking system. I am Almaz Zerai, here in clinic Asmara, Eritrea. I use the platform for quite a long time, but you know, after using the platform for some time, it is becoming mechanical. So I was using that only for booking as a booking system. I haven't seen even or open the other sites. And what I saw today was wonderful, and thank you for organizing this webinar. And I have seen the training, the feedback from colleagues, which is wonderful. Thank you for organizing the webinar. Thank you.
So thank you very much for your feedback. Really appreciate it.
Great, and we have a couple of comments, questions in the question box, which many have been addressed, but basically asking about, I think it's the usability of the hub, whether you can see the calendar for the doctor and the clinics all together. And then there was a question also about the invoicing, whether it can be coordinated for each mission separately. Over to you, Clementina and Flavia, with this.
I let Flavia to answer.
So I actually replied to the questions. I'm not sure if it can be visible, but anyway, let's go back. Let's go through them again. So regarding the availability of the doctor's calendar, as for now, the calendar shows all the appointments for the clinic in general. So if you have more than one doctor, you will see all the appointments there. However, there are some additional features, like for example, if you have both online and in-person consultation, these are shown with a different color on the calendar, so that you can quickly see which kind of consultation you're gonna have. And of course, for any specific detailed, let's say, description of the usage, I would always suggest to contact us at the email that is shown now on the screen, which is global.humanitarianbooking@wfp.org, so that we can go more into details about the usability. Regarding invoices as well, I'm not sure I understood the question, but in the invoicing section, that relates to each specific clinic connected to the digital office. However, you also have the possibility of not retrieving the booking details and then create, let's say, have a blank invoice form to be filled that, of course, you can connect to whoever you want. So you also have the possibility of creating an invoice which is not related to an appointment, of course. So let me see the other one for Kazakhstan. For payment, so yes, I think this relates perhaps to a specific via the hub. Okay, I'm seeing. I think it's specific for Kazakhstan operations that we have. But anyway, I will reply regarding payment. If you don't have info, it means that you didn't register any invoicing. So I suggest you just try it out, the section. And of course, if you need any support, you can always contact us. For the calendar, does it show all appointments via the hub or indulging other? So the calendar automatically shows all appointments you have confirmed through the platform and which have been submitted by from the platform. However, you also have the possibility of manually adding an appointment from the calendar. So you can access it and you can register manually an appointment which perhaps was performed, let's say, by phone. You can either ask the patient to book online, or you can also register the patient manually and have it shown on the calendar altogether. Concerning the payment, let me see. Please advise the procedure for indicating the price. So the price is actually is a free field, so you can input the price yourself. In the future, we will evaluate whether also to create an automatic let's say, price table for the invoicing, which will still be set up by the service managers. So each clinic, of course, has the possibility of setting up the price themselves. So the price is really related to the clinic. You might have, let's say, a free of charge clinic. You might request a payment which goes through the insurance, for example. There are a lot of different cases. So if you want to have more information and for your specific case, please always feel free to contact us, and we can give you support on that and organize perhaps a specific demo and a call to clear all doubts. Thank you.
Thank you very much, Flavia. I also posted in the chat box the feedback form. So you can leave us your feedback. It takes literally 1 minute. So it's very valuable. If you do so, we appreciate it. Before concluding, I would like to also hand over to Alessandra Bianchini, Global Mobility Manager. Alessandra, if you're there, we'd like to address any final remarks.
Thank you, Luis. I have some problems with my camera. I think the camera is coming back. Yeah. Yes, I wanted to echo what Zamir was saying. Of course, the tool has been proven to be a great collaboration tool, and this is the reason why we are here proposing it. And as Zamir was saying, the mere fact of setting it up in a location is, of course, interesting to the point where staff of the different agencies know that the services are available and they use the service. So it's always a collaborative tool. It works if, of course, the clinic uses it, and also the agencies enforce the knowledge and the awareness of the platform for staff to use it. And we have seen our operations that it did increase the utilization of the medical services. So it has been proven a very important tool, particularly in very remote areas where people think it's complicated to access to medical services. With the app being available everywhere, and with the hub also the website solution being there, it really gives the perception to our staff that services can be much more easily reached. So this is again to tell you that this is a common effort, because again, somebody might be running the clinic, but have our staff being informed and being known about the opportunity to do it. Maybe just last word about it is that we are in the process of digitalizing the HUNAS, also ticketing online ticketing system, so that it's going to be easier for agencies to also book HUNAS flights, and that coupled with the mobility and also the medical services would be a very, very important enhancement to have our colleagues in the field access services, in particular.
I think we might have lost Alessandra.
Yes.
Okay. Great, Alessandra, if you connect, please let us know. We have one last minute question that I think is quite relevant. It's asking, in the event of COVID-19 pandemic, how do you factor in screening questions required before accepting a patient's booking? Over to you, Clementina or Flavia.
Maybe I can reply. I don't know if Alessandra is still hearing us. So regarding COVID-19, Alessandra, you want to reply?
I missed the question. Sorry, if you can repeat the question.
Sure. The question was that in the event of COVID pandemic, how do you factor in screening questions required before accepting a patient's booking?
Well, we had the same problem at the onset of COVID. We had the same problems on all the services provided on the hub. So the easiest way for us was to have an attachment to each booking form, where staff could upload their daily, self-declaration for COVID. So that was like something that we did in a very rush back in April 2020, and has been proven very useful, particularly also for the accommodation business, where of course we needed to make sure that people accessing and staying at guest house would be, let's say, COVID free. The other thing that we did, particularly that was also again for accommodation, we added a field in the booking form where we were asking the country where colleagues were coming from, because that was also something at that time at least was very much interesting to be done. So if we work together and you have any particular, let's say, form that you want to include or anything that we can actually promote, we can look at the solution for a specific location. And then one of the good things about the hub is that we can streamline best practices everywhere. So far we have left the, let's say, the questionnaire, which is specific to each single location, but we could also come up with something that is agreed among all of the medical facilities to become, let's say, a standard to be used for each bookings on our platform. Over.
Thank you so much, Alessandra. Glad you were able to connect again. I know we had originally intended to be an hour and a half. We wanted to keep it as short as possible. But there is one question also from Almaz. The first one is asking, is it necessary to download the new platform, or can I use the previous one? And the second one is if we can send the PowerPoint to use for awareness for your staff. Yes, we will be sending a PDF. If you require a PowerPoint, you can let us know and we will be glad to share that as well. So on the first question of which version to use or to download, I'll hand it over to the colleagues.
Yeah, I can reply. Thank you. So first of all, I would like to thank Dr. Alma Zerai from the UN clinic in Asmara, Eritrea, for the great feedback. It's always a pleasure. And regarding the question, so at the moment, you can choose whether you let's say, which kind of booking you want to apply to your clinic. But I would suggest perhaps I'm gonna send a dedicated email later on so that we can connect directly and I can show you in details let's say the different functionalities which are available. So perhaps we can just go through it in more, let's say, in a one-to-one call. Otherwise, we will. Now is a bit late, so I don't want to keep anyone. But I take the occasion also to just leave my final remarks. I already thanked Dr. Ahmad Zerai from UN Clinic in Asmara. I want to thank as well Dr. Firmo Berati from Monrovia Clinic in Liberia. And also Dr. Said, who is informed me that unfortunately he had a medical emergency to attend to, so wasn't able to speak today. But of course, you will see them contribution in the presentation. And thank you everybody for attending. If you have any additional questions that we didn't have time to respond today, please always feel free to send us an email and we can follow up with you. And thank you, of course, also to UNDCO team for all their assistance and the possibility of having this presentation today.
Thank you very much to all the WFP colleagues connecting, for all of you joining us today as well. I had put on the screen the next upcoming webinars, which is the ICT and digital accessibility. We look forward to having you. We thank you for being here, and we'll follow up with an email with the recording, the PowerPoint, and the practice notes. Thank you and have a wonderful day. Bye-bye.
Thank you.
Thank you. Bye. Bye-bye.